This
rituals and
conference will now be
celebrations
recorded.
in healthcare settings. Let's try that again. We'd like to welcome you today to a person-centered approach to meaning making, rituals and celebrations in healthcare settings. And I'm very excited. I'm Lisa Maurice to welcome you here today. And if you have questions as we go through this, we'd welcome you to chat them in using the chat feature that is on the navigation bar. And we'd ask that if you're not speaking, if you would be so kind as to please mute your line so we don't hear all the wonderful background noise that we all have. I've asked my dog to not bark, but I can't guarantee that that will happen. We are going to today have two main presenters. One is my colleague and friend, Rachel Weisberg. Rachel is a patient advisor and an organizational system consultant who is currently based in the San Francisco Bay Area. I met Rachel first when she was working at the NQF, National Quality Forum in Washington, D.C., where she managed several Partnership for Patients initiatives, including the Patient and Family Engagement Action Team. She also supported measure application partnerships, policy recommendations to the Department of Health and Human Services on the application of performance measures in public reporting and payment-based federal health care programs. Prior to being at NQF, Rachel worked at the Endocrine Society and the Leapfrog Group, where she ran programs focused on patient education, patient safety, and affordable care. She has a master's degree in organizational management from George Washington University. And Rachel is a strong voice for us in healthcare since she personally manages 3 health conditions. Her blog is worth checking out. It's called sleeplikeababytonight.com. And she's going to share a personal story with us. And then we're going to hear from Claudia Ricks-Hubbard, who I've just been delighted to get to know over the past little while we've been working on this. Claudia is a senior staff chaplain at Children's Mercy Kansas City, which is a freestanding 350-bed pediatric hospital in my hometown of Kansas City. She's served there for 16 years and currently serves the hematology, oncology, and bone marrow transplant team. Reverend Hubbard has had the interesting challenge of creating the role of chaplain educator for the hospital. So she shares this kind of wonderful information that you'll be hearing today with her colleagues. She has a bachelor's from Wichita State University and a Master of Divinity from the St. Paul School of Theology, and did her clinical education at St. Luke's Hospital in Kansas City, Missouri, in the hematology department. Just to be a well-rounded person, Claudia likes to read, garden, cook, and entertain, and is going to launch Christmas cookies hopefully sometime next week, but like the rest of us, is not ready for her family's holiday celebrations yet. If you have questions or comments, again, you can chat them in on the chat feature, or save them, and we'll hopefully have time at the end for you to share. So now I'd like to I'd like to go over our objectives quickly. We're going to talk about the importance of providing whole person care and how that alleviates the sense of stress and isolation a person may encounter when they are especially inpatient, but in an encounter situation in healthcare. We're going to talk about JCAHO and chaplaincy standards for serving the needs of all patients. These are expectations, and we want to help you be able to meet those. We are also going to learn about the importance of connection in meaning making and how staff can support patients, families, and importantly, other staff. And the last thing we're going to look at is actual rituals and celebrations that promote connection and well-being. So with those things in mind, I'm going to turn it over now to my colleague, Rachel Weisberg. Rachel? You may be on mute.
Yes, sorry. Hello, everyone. I'm Rachel. Thank you. I was having a little bit of technical difficulties with my computer, just suddenly going black, so I was attempting to fix them. But hello or good afternoon to everyone. It's a pleasure to speak with you all. I'm going to share a patient story with you that took place back in 2008. As Lisa said, I manage several medical conditions, and one of them is that I'm a migraine patient. Back in 2008, I experienced a situation where I was far from home, and I was placed in the care of a hospital in Chicago. I was living in Washington, D.C. at the time. And the story is really about, since we are talking about ritual and celebration and meaning making during the holidays, the story is about, what are the feelings and experiences of patients, during those times. I was far from home, and I was anticipating a lot of loneliness and isolation. And what happened was that I experienced something really quite different, quite the opposite, a real celebration and a sense of community and belonging. Next slide. So, let me go back one. So as I said, my neurologist had suggested, because of the severity of my migraines, that I go to a specialty headache clinic that was in Chicago, and they had recommended that I actually spend a month inpatient at their hospital in St. Joseph. And love the picture of the hospital on North Halsted. And just the one point that I want to reemphasize here is the last bullet point was that what I found was a community that was intentionally created by the staff that was focused not just on physical care, but on whole person care. Next slide. So how did they do that? So when I arrived, I was shown to a private room. I was, as many patients, I was going through physically a form of detox because I had been put on, I had actually been on 33 different medications in the course of 9 months for my headaches. So part of what was going on physically for me was just a lot of pain management and some withdrawal symptoms. So all the patients had private rooms. And one of the things that was foremost in the minds of the staff was how to both, attend to the physical needs of the patients while at the same time connecting all of us. So the way that they did that was through a variety of ways. They very specifically introduced us to psychologists. They asked us, what are your religious backgrounds? If you have any, here are the spiritual advisors that are ready and available for you. They provided us a daily schedule in which we were encouraged to go to things like meditation rooms, art rooms, to have all of our meals were served together, sort of like in a little cafeteria. We had movie nights. We had times where groups of us would get together in like a little common area and have facilitated conversations about specific things related to our migraines in which we could sort of give and take advice and encouragement. And over the course of that month, we not only grew to know one another very well, but to become quite close. And, it's interesting because what I remember from that time was just these lovely memories of very individual faces and stories because of these moments of community and relationship building. Next slide.
That's it. That's what we have.
Are we missing a slide?
Did we miss a slide? I'm sorry.
Okay, that's all right. So that's all right. I'll switch to my last slide. So I had a few other points that I just wanted to make, and they're really about, how do we make the holiday time meaningful for patients? And what I anticipated going into this was, as I said, a feeling of loneliness, because the holidays are really meaningful for me. I am very close to my family. I was far from my home and from my friends. And I'm the kind of person that I love decorations. I love the music. I love the gifts. I love all of that. And I am sure that ward of that part of the hospital was, had some decorations and, was that some of that was attended to, but I have no memory of that. And I have a very good memory, which is interesting because I think that what I came away with was that what is important to people, what connects people during the holidays is that sense of sort of joy and connectedness that we have from our memories around the holidays. And that because staff at the Diamond Headache Clinic attended to whole person care, that they were focused on our mental and spiritual and emotional needs, that they got at sort of the root issues that we need as human beings, and that is something that we as patients need, obviously not just during the holiday season, but all year round. And it's a lesson that we can take away throughout, all of our healthcare. You're going to hear next from my new friend and colleague, Claudia. And I think that some of the things that are done in children's hospitals are really sort of above and beyond the norm in adult care, because we naturally understand that children they have these emotional needs that have to be met. And so, you'll go into a children's hospital and you'll see things like art rooms, or you'll see, music shows, or you'll see things that you often don't see in adult care, but it seems natural, because of course children need those kinds of things. So that really was my takeaway from this experience, was that, adults are whole people as well as children, and that these are the kinds of things that need to be attended to. So with that.
That's a great point, Rachel. Thank you so much. And I totally agree with you. I always thought that we need to promote child life for adults, and I'm not sure we'd call it child life, but certainly something similar to that. And now we'll turn the time over to Reverend Claudia Ricks Hubbard.
Good afternoon. I am very pleased to have been invited to join you all today. My task in this is to indicate to you how and why chaplains contribute to meaning making for patients families and staff in a hospital setting. Hospital settings can all too often be seen as clinical and unfriendly. I have the pleasure of working in a children's hospital where that is totally not true. We have color and whimsical art all throughout the hospital. Next slide, please. Our chaplain staff, we are all personally committed to openness and to serving every person that we encounter. That is a personal commitment that we each have, but we also have a mandate from the chaplaincy world and chaplaincy standards. We are required to respect diversity, whether it's cultural, gender, sexual orientation, racial, any of those types of things that might make one feel different, if you will. It's our task, among our tasks, to bring those people to a sense that they are part of a community here. And that has been emphasized, and also it's emphasized with the need for us as chaplains and others in our hospital to respond with cultural humility, not to think that we absolutely know what's best for someone else or someone else's situation, but to be open to dialogue with the patients and families and staff members to see what indeed is important and how they connect and relate through those things. Next slide, please. As I mentioned with the cultural humility, we need to be very aware of our bias and prejudice, because very often we are not aware. And it is our task to be sure that we do not impose our own assumptions on any of our patients or families we work with. We respond to patients in a way that hopefully makes them feel welcome, hopefully makes them feel well respected and important, and helps to facilitate the sense of being partners, not only in their medical care, but in the care of their well-being during their hospital stay. Next slide, please. We're all familiar with JCAHO, and my hospital is anxiously awaiting a visit from them very soon. And our JCAHO, excuse me, guidelines, again, require that each patient is assessed for cultural and religious beliefs. And I think this part's very important. The emotional barriers or other barriers that may contribute to a sense of isolation or loneliness. The most obvious of those, I think, is language. Many times as I sit with families who do not speak English as their first language, even though we are very committed to an excellent staff of interpreters, I sometimes wonder what it's like for these parents to sit with a child sick in the hospital and not really understand what's being said. So language is such an important place for us to focus in terms of trying our best to eliminate barriers. Next slide, please. As you probably have picked up on from my language already, it's very important for us to realize that we have three constituencies. We have patients, we have their families, and we have our staff. Very often people are not aware of the fact that chaplains are here to serve the staff also. They are part of our responsibility and constituency, if you will. And a large part of what we do, as we have talked about already, is helping them to not feel isolated, not feel lonely, to reduce fear and sadness and grief. Those are the things that often make a person feel less whole, less healthy in an emotional way. So we work to facilitate connections, and just this is like a very brief breakdown, but often we work trying to facilitate those connections by helping us to understand the patient or family or staff members' understanding of God. What is divine to them? What is their community? Who do they turn to for support, emotional support, when they are in a situation like having a child in the hospital? What is the meaning of this hospitalization for them? For some, it's, I mean, obviously every patient who comes here, their parents bring them here hoping and praying that their family will walk out of here with a child who has been cured. All too often, that is not the case. We have many children who have very chronic illnesses, and for them, they might have come from hundreds of miles away. They might be isolated from their own families, as Rachel had mentioned earlier. One of the big things I hear patients or moms especially and dads talk about is that sense of tension between never being in the right place. If they're here with their child who's ill, they are not at home with their children who are having their birthdays and their first days of school and their piano recitals, all of those things that are so, so important in the life of a child and a family. So today I'm going to talk about rituals and celebrations, and I'm going to use the word ritual more, but celebrations are a type of ritual. And among the things they do for us is they bring order to chaos. We see this so often in the hospital. It is a chaotic situation for families, especially when they're new here and they don't know the directions and they don't know the very basics of what's going to happen. Rituals can also help us connect at a deeper level to things that are inside of us that are important that maybe we hadn't even articulated yet. And often they help us to connect with something greater. As this slide shows, rituals mark the passing of time. Everything from having a birthday to passing on a tradition from one person to another. Obviously, funerals. I know that if we all think about it, we have countless things that are rituals. Even the simplest things like when we get up in the morning, brushing our teeth and having our coffee and reading the newspaper, whatever those things are. Haven't you had that experience of not doing those things or not doing them in the usual order, and it kind of throws you off for the rest of the day? Rituals also mark a change in status, whether it's passing from a child to adulthood, a graduation. I love the one with white coats as a hospital person. The change from a short white coat to a long white coat. The students wear the short ones. And so when you wear a long white coat, that is a very important thing. Next slide, please. Again, rituals are both secular and religious and take many, many different forms. Next slide. Very often, rituals are related to or associated with some kind of symbol, whether it's the lighting of the candle or the prayer flags in Tibet, or the wedding rings, or a Celtic cross. Any of these things, the dot on the forehead, these things symbolize to other people that something important either is happening or has happened. Rituals often involve, as we're well aware in hospital settings, different practices with foods. We always try to make sure that our patients have the foods that they need to be culturally appropriate, and also how people react to one another. For instance, in some cultures, a man and a woman do not shake hands. They do not touch one another unless they are husband and wife. Next slide, please. Rituals are a way to provide safety and security. They tend to be constant. They enable us to carry out what might seem like very mundane tasks without much effort, because we do it all the time and we know what we're doing. One of the things I like to think about, they are spiritual. They often take the very ordinary things in life and make them somehow extraordinary because of the way that they connect us to something much greater than we are. Next slide. Again, this one continues with rituals help take us from that which is very ordinary into something that is sacred. It takes us from brokenness to wholeness. They can take us into new identity or status. They become important milestones in our lives. Next slide, please. Rituals can be very complicated. They can be very simple. But the most important thing is they operate on a soul level. And so they help one to shift deeper into themselves, to find their own resources, as well as the resources they have around them that help them connect within the hospital. Next slide, please. This slide I just had to share. I thought it was so sweet. In many communities, this picture is actually from Tibet, but the community is ordered by the ringing of the bell, different prayer times, different morning and night times. And so the bell is that symbol of ritual that holds a community together. Next slide. So it's important for us as chaplains and other people in the hospital to maintain cultural practices, help families to do that. And in order to do that, there's a real collaborative effort in our hospital between the Spiritual Services Department, the Equity and Diversity Department. We have patient, parent, and teen board advisory committees that help us to understand what it is to be a parent and a patient here. We also have two wonderful people. I know one of them is listening today, who have been parents who were here under very stressful and difficult situations. And they can sit down and talk to families in a way that someone who hasn't been there could never even begin to imagine. Next slide. Rituals are individual. This is a slide that's kind of tightly cluttered, and I apologize, but I wanted to put it all in, that I wrote for a patient I was working with who was about to receive a bone marrow transplant. As I had worked with her over time, I knew that reading was very important to her, and I asked her sometimes what helped her to cope with all the stress. And she said reading was one of her primary coping mechanisms. And so as I began to think about a ritual for her and the receiving of this bone marrow from someone else, I wrote this ritual that says her transplant is like a new chapter in a book. It will hold unexpected twists and turns as it furthers the story of her life. And that is so true. When I write these, I try to find that key piece that's important to someone. It might be a seashell in a scene of an ocean, lots of different things, but I loved this one with the chapters in a book. Next slide, please. Obviously, at our hospital, we do very many bedside baptisms. Those are very private to families. Sometimes our children are too young to really know what's happening, but sometimes we have the honor of baptizing older children or older siblings as we baptize an infant. Next slide. And rituals are also communal. One of the things that we love doing here is a blessing of the hands, a time when people are invited to come and have their hands anointed with oil, and just a short blessing said to them to honor the work that they do and how that's represented by the ways that they use their hands. Besides having people come to our chapel to receive that blessing, we also go into each unit because we realize that not everybody can walk away from the patients who they're caring for. And so we go to the units, we make an announcement that we're in a unit and invite the nurses and care assistants or anyone else who's working there, environmental services, to either come to us on that unit or let us know that they'd like to have their hands blessed, and we will go directly to them. Next slide. So some of the things that I'm going to talk about next raise the question of how and where do you do some of these things? I have to put in a little plug. At Children's Mercy, we are so blessed to have a relatively new chapel space. I say new, I think it's about 6 or 7 years old now. But it is, when it was designed and as it has lived into its purposes, it's a place where we are committed that everyone is equal. But not everybody has a beautiful chapel. So I want to challenge you to think about other places in your hospitals or places that you work. It might be just a simple meeting room. And by the use of an electronic candle and maybe some beautiful fabric, you can make that room feel different. You can make it have a sense of holiness. And that sense of being a sacred place comes as the tears and the prayers, the laughter, the laments, as all of those are shared, our chapel space and other spaces become a bit more rich. In our gathering space in the chapel, we have regular Sunday worship services. We have a Sunday Roman Catholic Eucharist gathering. And again, if a family would like to receive the Eucharist and cannot make it to the chapel, the Eucharistic ministers will get a list that the chaplains have left and go to the individual rooms to offer this sacrament of the Eucharist to families and patients. We also have what we call Wondrous Wednesdays, and those are events that happen on Wednesdays that sometimes are worshipful, sometimes they're educational, sometimes those lines blur between the two. Yesterday, we just had a rabbi come and talk to us about Hanukkah and the meanings of Hanukkah and the lighting of the candles. Next slide. I forgot to mention on the other one that we also have a regular schedule of meditation a couple of times a week. This picture, it looks kind of blah right now, but it is a prayer wall. And there are normally slips of paper on that little table and pencils where people can write their prayers, be they prayers of joy and thanksgiving or prayers of crying out to God for help and support. And they put them in these crevices in the wall. You might have already guessed that this wall is fashioned after the Wailing Wall in Jerusalem. And this has become a very meaningful part of our hospital. We did learn that we had to have some kind of plan because in Jerusalem, it's outside. And so the little slips of paper deteriorate with the weather. And this one is very much inside. And so we take the prayers out every Sunday, and we pray over them collectively during the worship service. One of my favorite images of just the diversity, we have a Muslim prayer area, we have the Wailing Wall, only we just call it the prayer wall. Lots of places where different people feel connected and comfortable. One of my very favorite images of that is on the very first Ash Wednesday that we worshiped in this space. As I was standing doing the imposition of ashes on people's foreheads, I was aware of a couple of Muslim employees who regularly come to pray at our prayer wall for the Muslims. And they came in quietly, went to the area where they were comfortable, and prayed while this other service was happening in the gathering space. And it just made me feel so excited, because that's exactly what we wanted in this chapel area. Next slide, please. Another of the very favorite places is our meditation garden, complete with a fountain and a wind sculpture. People tell us how important it is for them to be able to go outside, sometimes even when the weather's pretty bad, but just to feel the outdoors when they have been confined to an indoor room for such a long time. Next slide. Our chapel also includes, and I apologize for not having all pictures of this, a quiet room that is just what it sounds like. It's a room with low lighting and comfortable seating, a place for people to gather and have conversations. I often meet staff members there who want to talk to me about something that's on their hearts. I'm also a part of the liver transplant team. I often meet a family in the quiet room to do my part of the assessment as they prepare to enter into a transplant. We have a library that is just stocked with sacred text, children's books, books on grief and loss and hope and inspiration. That has been a very fun place for people to go and find meaningful things to read. And lastly, we have a Patty Ann room. And one might ask, what in the world is that? It is a room that is dedicated for family use with their patient. It has along one wall behind beautiful cabinetry all of the medical hookups that one could possibly want. So if a child needs oxygen, they can come down and plug into the oxygen there instead of having to carry multiple tanks. That's also true in our gathering space. There are places that have medical gases available. In our Patty Ann room, families gather for rituals. I worked with one family who had a very hard time making a decision about the end of life for their child. And they said to us, when we have big things to decide, we gather as a family. Where can we do that in your hospital? And we offered them the Patty Ann room. And the dad went home and smoked briskets and chicken and brought it back with all the sides. The family with the little infant in the room with them, plugged into all the required medical gases, spent time together as a family. And at the end of that time, this family was able to disperse, and the parents were able to go and make a decision about the end of life for their child. Sometimes people bring their children down there to be baptized, either in the big gathering space or sometimes the Patty Ann room. Sometimes their children are extubated, and parents will have said to us, I so wish that my child had been able to feel the sunshine and the breeze on their face, but they've been in the hospital their entire lives. And so we make it possible for them to take their child and walk in the garden. And we've had times when parents were carrying their child and their child actually dies when they're in the garden. Very peaceful. When the family's ready, they come back to us, and all of the other things that need to happen around end of life happen. But the family has had this quiet and peaceful time, a time to expose their baby or older child to the outdoors and the wonder of nature in a maybe just a very small way, but a very important way. Next slide. Yes. So I'm going to just quickly go through some of the different rituals that we celebrate on a regular basis. Obviously, the Christian times of Advent and Lent. And again, our Wondrous Wednesdays during those periods often tie into a theme from those two very significant Christian times. In the Hindu tradition, we celebrate Holi and Diwali. These two celebrations are largely driven, planned, and even led by people who are on our staff here, doctors and others who are Hindu, and they want to have this presence also represented in our chapel. And you can tell from looking at the pictures a lot about color and light and what that brings to an environment and how it creates love and a sense of loving in a time when people may be feeling isolated and alone. One of the things that we do is during the Muslim month of Ramadan, to help our both, again, families and our own employees, at the end of every day, we've set this table for people to break their fast. They've been fasting from sun up till sundown. We actually have a chart that gives us the exact time of sundown, and people come and break their fast around this table where we have very simple things, water and milk and juice and fruit, and dates are very important. So we invite these people who otherwise might not have a really meaningful way to break their fast to break their fast. Next slide. And at the very end of Ramadan, there's a bigger celebration called Eid al-Fitr that celebrates the breaking of the whole time of fasting during Ramadan. And again, it's a beautiful ceremony. We have a lot of staff members who participate in that, and parents who come down for that. Children, if they can, if they're not in isolation. Next slide. Obviously, the Jewish holidays of Passover and Hanukkah. As I mentioned earlier, yesterday, Rabbi Jonathan Rednick was here talking to us about Hanukkah and what that means in the life of a Jewish person. And in the spring, when we have Passover, we again have a rabbi come and sit with us and talk about the Passover and the meanings of the different foods that are on the plates that you see. Next slide. This is a celebration that came to us from our Spanish-speaking advisory board. It's the Day of the Dead, or Dia los Muertos. I'm not Spanish-speaking, so I'm sure I just butchered that. I apologize. But it's an important part of the Mexican culture, helping people to connect with their ancestors, to celebrate life and death in a way that says, death doesn't have to be scary. It's a part of life. And it brings us again together in a very meaningful way. Next slide. And this is also the Day of the Dead. Very colorful light, and the people from our Consejo board, which is the Spanish-speaking board, are very, very involved in planning and participating in this. Next slide. We also every year celebrate Kwanzaa, which connects people to 7 very important principles of life. The woman on the, as you're looking at it on the left in the purple and gold, is Tracy Woods. She's also a senior staff chaplain here, and will be leading, I apologize for that noise, will be leading the Kwanzaa service this year. Next slide. We every year celebrate Martin Luther King Day and Black History Month. We usually have guest speakers. We talk about these things because they're important history, and they're important history that sometimes gets overlooked. And we want to make people in our hospital environment understand that these are very important times for us too. Next slide. This is one of our newer celebrations, the Pride Chapel celebration. On the top left is Paul Kopinski. He's our new CEO and president. He's doing the welcome. On the top right is Katie Chipolis, who is one of our chaplains also. And then a male chorus that comes and sings for us. Obviously, this is a very well attended service, and again, recognizes people who might feel a bit on the outside and pulls them in saying, we are so glad to have you here with us, and we recognize the importance of you all in our community. Next slide. And Veterans Day. Again, it's a largely collaborative effort. We have the different service flags. This year, our speaker was Dr. Choi, who is a Lieutenant Colonel in the Air National Guard. She also is one of our surgery fellows. And so it was a joy to hear some of her story and how being in the military has helped to shape her life. Her family, her parents came here as immigrants from Korea with basically nothing. And she just marveled at the fact that her parents worked very, very hard and instilled in their children that same work ethic and that same hopefulness. And so it's a joy to hear Dr. Choi. Next slide. I must tell you, these leaves are ginkgo leaves. And I put the title of grounding because the ginkgo, the tree and the leaves, are often attributed with healing experiences, resiliency, physical healing, hope, and peace. And I think that's so much of what we try to do. And if we were standing together in our chapel right now, in the gathering space, if we looked down, we would realize that we are standing on a hand-woven carpet that has ginkgo leaves woven all into it. And every time I'm down there, I see those leaves, and it just makes me so grateful for all of the things that we can do to help our families and patients and our staff members to connect with these things, the resiliency, healing, hope, and peace. And then I have just one quote that from Henri Nouwen that I thought spoke to this whole presentation. And I'm going to read this one to you. It is in the usual, normal, ordinary events that we touch the mystery of human life. It is precisely in the moments when we are most human, most in touch with that which binds us together, that we discover the hidden depths of our lives. Thank you very much for listening. And there's my contact information. If you have questions, I think we're now ready to entertain questions. Is that right, Lisa?
That is right. And wow, thank you so much, Reverend Claudia, for putting all of this together for us and taking the time to share with us these important concepts of looking at the whole person and noting the diverse ways in which we can address that, from persons' organized faith traditions to newer traditions that we may be becoming aware of, to their associations in organizations and groups. It's all very important. And when we talk about healing, we do so much to be mindful of that. I had some questions, and I haven't seen any questions popping up in my chat yet. If there are, if you would let me know, because I can't do the screen and the chat at the same time. But how how do you assess a patient's or family member's needs?
That's an interesting question. And I think for the most part, if you were to walk by a room where there was a chaplain and a family member or a patient having a conversation, it would look just like that. It's a conversation. It's not structured. I don't go in with a list of questions, but in listening and asking open-ended questions of that person, I begin to form an image of what's important to them. Again, back to the what brings meaning, or what is the meaning of their experience right at this time, like Rachel had spoken of. Where is their hope? And so in conversation, and how do they understand the divine? I worked with one mom who had a child who had cancer, and she had come from a tradition where God was portrayed as a very judging and almost sometimes cruel God. And as we worked together over a course of time, we got to the place that one day we were talking about God as a gentle and loving presence. And I asked that mom, what might it feel like to you to crawl up into God's lap and receive a hug? And this mom just burst into tears. It was such a different image from what she had been taught as a child.
Aww.
So listening is how we do that assessment.
Well, and you ministered to this person, which is so touching. How are families referred to the group meaning-making opportunities that you have at the facility, like your Day of the Dead celebration or other things that may happen in your gathering place?
Again, our hospital tends to be very collaborative, and we advertise these events, obviously. We have something called the Daily News that goes out electronically every day. And then a lot of referral. Our child life specialists are great about going to families and saying, this is going to be happening in the chapel. Would you like to participate? And we make overhead announcements, and we have a big placard outside of the hallway that leads into the chapel that just announces that these things are happening. And so as people go to the cafeteria or the gift shop, which you have to walk between the two to get to our chapel, so that's a great traffic way for us. There are visual reminders of the things that will be happening. And word of mouth, that's always the very, very best.
Isn't it? And that's great that there's so many cooperative efforts among all the disciplines to bring these opportunities to light. I'm wondering, those are kind of the collectives that Rachel was talking about, but in terms of individual assessment, like the mom that you were mentioning that you ministered to, how are families made aware of what opportunities they have to receive spiritual support?
That's a very interesting question. We are fortunate enough at our hospital to have a very large staff of chaplains. Right at the current time, there are 10 of us, I think. A lot of hospitals operate with 2, maybe 3 full-time chaplains. So we have the luxury, assuming that we're not involved in the crisis of the day, which we all get called into from time to time. We have the amazing opportunity to make rounds. We go door to door. I knock on the door and introduce myself, ask if I can join a family, and again, start that dialogue that lets them know that there's someone there to talk to them about something other than just their medical conditions. We have on our admission form that the nurses all do with a new patient, one of the questions is, would you like to see a chaplain? And very often they say no. Our nurses and our social workers and our child life specialists are great eyes and ears for us, because obviously we can't be everywhere at one time. And we have asked them, if they see a family who seems distressed, or they know a family's about to receive difficult news or just has received news, don't go to that family and say, would you like to talk with the chaplain? For a number of reasons. Often the families will say no because they don't know exactly what a chaplain is and what we might do. They often have had a bad experience either in a church or in a hospital with a chaplain that makes them think, no, don't want that, thank you very much. They may think that we come with preconceived ideas of what they need. We're going to come and tell them how to fix all of this, which could not be further from the truth. And so we ask our staff to call us and say, family in this room is experiencing this, and I believe that they could use your support. And we go. And that gives us the opportunity to introduce ourselves and what we do to the families, instead of just having a quick, no, I don't need that. One of the things I always say to a family as I meet them is, I am here to support you in whatever way is important and helpful to you. And that really can open up dialogue about what is important to that family or that patient. How do they like to be supported? Does that answer your question?
That does. That's very helpful. And, you know, my next and last question, which we only have about a minute to answer, I'm sorry, but is,
I'll be quick.
You know, you're a large regional medical facility. They're in a very large metropolitan area, one of the largest in the country, and yet you're surrounded by communities that are very rural, and there are a number of small community hospitals in your service area, or critical access hospitals. Have you, by any chance, ever had any telehealth kinds of encounters as a chaplain, or is that something that you all have talked about?
That's not something that we have really gotten involved with at this point. As we're going more and more to the telemedicine, I think it's an opportunity, but it is not one that we have taken advantage of at this point.
Okay. Well, I want you to know how much I totally appreciate your being a part of this educational opportunity. You and Rachel, you both have just brought us a rich background and understanding of how we can support both individuals and groups when they're experiencing a healthcare encounter. And I hope that this information is useful to those of you who have tuned in and those of you who will be tuning in to visit the recording. We do have webinars coming up, including Healing After Harm, with a discussion of the Candor Project. And in February, we'll be looking at Speak Up, how to speak up and encourage speaking up to avoid medical harm. I am Lisa Maurice, and this is how I can be reached. Please check out Consumers Advancing Patient Safety at our website. And thank you so much for taking the time on your busy holiday Thursday to join us and learn about meaning making. Everyone have a lovely, lovely rest of December and a happy new year. Thank you so much.
Thank you.
Thank you.
Thank you.
Okay, as our friends sign off, I want to say thank you again to you, Claudia, and Rachel. You are amazing. Really
Thank
amazing.
you.
easy.
This conference will now be recorded.